Welcome everyone and thank you for tuning in. I'm Michael, your host for today's podcast. Recently, the third CBD Academic Salon and the first Northern China Varicose Veins CHIVA Salon was successfully hosted at Dr. Smile Vein Center Beijing. This esteemed event gathered leading medical professionals and researchers from around the world to exchange insights on the latest advancements in CHIVA technology, a cutting-edge approach to varicose veins treatment. Among the distinguished speakers was Dr. Lei Su, director of Dr. Smile Vein Center Jinan. With over 2 decades of experience in varicose surgery and venous disease management, Dr. Su has been instrumental in promoting and advancing CHIVA technology in China. Dr. Su, it's a pleasure to have you with us. Thank you for joining.
Thank you, Michael. Hello, everyone. I'm really excited to be here and share insights on CHIVA and how it's transforming varicose vein treatment.
Dr. Su, let's start with the salon. I heard it was an impressive gathering with international experts from different countries.
Yes, it was an incredible event. We had experts from China, Spain, and Japan, along with doctors from top public hospitals across China, including Beijing, Tianjin, Jiangsu, Zhejiang, and the Northeast region. The discussions were dynamic with one main goal: finding the best treatment options for patients.
That sounds like a gold mine of knowledge. I heard many real clinical cases were discussed as well.
Absolutely. Experts presented real patient cases, highlighting the challenges in treating varicose veins. For example, at Dr. Smile Vein Center, we treated a patient whose varicose veins were so severe that they significantly impacted his daily life. Thanks to CHIVA, we improved his symptoms without the trauma of traditional surgery, and his recovery was much faster.
That aligns perfectly with CHIVA's philosophy: precise assessment and personalized treatments rather than unnecessary procedure.
Exactly. One of CHIVA's biggest advantages is that we carefully assess whether a patient actually needs treatment, and if so, determine the optimal timing for intervention. Instead of a one-size-fits-all approach, we tailor treatment to each patient.
That's fascinating. So how does CHIVA differ from traditional treatment?
Great question. Traditional treatments typically involve cutting off or sealing diseased veins, assuming that removing them solves the problem. But in reality, the venous system is like a complex traffic network. Blood flow follows a structured order. If we simply block veins without planning, it can increase pressure on other veins, leading to new complications. CHIVA instead focus on optimizing blood flow to ensure the circulatory system functions more efficiently.
That makes so much sense. So CHIVA is like traffic optimization. Instead of blocking roads or demolishing bridges, it improves circulation.
Exactly. Before treatment, we'll conduct a detailed evaluation to determine which veins are actually diseased and which are simply passively enlarged. If a vein still plays an important drainage role, we preserve it. This results in faster recovery, fewer complications, and a lower recurrence rate for patients.
Can you share a specific patient case to illustrate this?
Of course, we once treated a patient with chronic leg ulcers caused by severe varicose veins. Traditional treatment would have sealed off the surrounding veins, but we used CHIVA instead. By optimizing blood flow and reducing venous pressure, the ulcer healed quickly, without necessarily damage healthy veins. This is exactly why CHIVA is so effective. It's minimally invasive, precise, and promotes faster recovery.
That's amazing. At the salon, Spanish and Japanese experts also shared their insights. What were the key takeaways?
Spain has extensive experience in hemodynamic optimization. Their insights were extremely valuable. From Japan, Dr. Xiaoning Tong flew in from Osaka to discuss venous adhesive treatment and how Japan approaches varicose vein care. I emphasize the importance of patients' involvement in treatment decisions, which aligns perfectly with Dr. Smile Medical Group's philosophy.
That's so important. Every patient is different and personalized treatment is key.
Absolutely. Last year, Dr. Zhang Qiang and I visited Japan to exchange ideas with top institutions like Osaka Vein Clinic and National Hill Hospital. Japanese doctors primarily use radiofrequency ablation and local vein stripping, but they were very intrigued by CHIVA, as it focused on improving circulation rather than simply removing veins.
It sounds like CHIVA has huge international potential. Are there plans to expand these salons abroad?
Yes, we are initiating the Global CHIVA program in collaboration with CHIVA experts worldwide and the Medical Accreditation Organization Intellios. In the future, we plan to host CHIVA salons in Japan, the US, and beyond. We are also establishing a CHIVA center in New York, which will serve as a key platform for global collaboration.
That's so exciting. Dr. Su, any final advice for our listener?
Take care of your vein health. If you notice visible veins, like pain or swelling, don't ignore it. See a vascular specialist for an evaluation. Avoid unnecessary treatment, but also don't delay care when it's needed. Stay healthy and take care.
Thank you so much, Dr. Su. This was such an insightful conversation. And thank you to our listeners for tuning in. If you found today's episode valuable, don't forget to subscribe and share with friends and colleagues. See you next time.